good morning, good afternoon, good evening, whatever time you're watching this, since it's shown at so many different times. I like to say this is Senior Issues, etc. I'm your host. You know me. You've been watching me for a long time. You've seen me gain a few, lose a few, and we have a good show for you tonight, so sit back, relax. This one's for you out there. Now, what I have with me today is two charming ladies, and they're going to explain the services. I have Leslie Piotrowski, she's the communication manager, and I have Dr. Mary Ratsky. She is the dental service. She's currently working out of Highland Park. And so, Mary, I'm going to start with you. You know, I know the audience. We've kind of grown up together because we pioneered this show. And so what they like to know is a little bit personal about you.
Oh,
okay?
Sure.
So if you just look right into that camera and
Yes.
tell them about yourself a little bit.
Sure. Well, I grew up in Chicago. I'm from the south side of Chicago originally. I moved to Lake County about 15 years ago. And I work for the Lake County Health Department. And I think the reason I am very interested in public health was because when I was in my early 20s, I joined the Peace Corps and I served in the Philippines in the mid-1980s. And I was working in a very remote, rural, very poverty-stricken area of the Philippines where there was absolutely no public health whatsoever. So there was no safety net. There was basically no hospital even where people could go to if they were injured. And I worked in that in that community for about 2 years and was constantly aware of all the needs that people had. And that there was not that much assistance that was available to really help people in their health concerns and their family concerns. And so I very much was interested in the not-for-profit sector when I came back from my Peace Corps experience, and I worked for several not-for-profits, including CARE, which is an international relief agency, and I worked there for about 3 years. I ended up getting my master's degree in public service management, and eventually came to the health department about 14 years ago, where I started off as the public information officer, and now I'm the communications manager.
Well, you know how fortunate we are in Lake County to have somebody with your kind of background because you have a heart for the community. So we're happy about that. Now we're going to go to Dr. Mary Ratsky, and she happens to be my personal dentist. So you know that I'm biased. So Dr. Mary, why don't you tell us that camera there a little bit about yourself?
Well, good morning, everybody. I've been living in Lake County for the past, let's say about 10 years. I finished dental school in Nebraska, and I did a residency in Florida. So I've been kind of like from the center to the south, and now we're here in Illinois. The reason I chose the field of dentistry is I find it very satisfying. I get immediate smiles from patients. You make a very, very quick change with the small procedures that you do, and it's just your teeth. But it's very important for people to be able to chew their food and, you know, be able to smile and get a job, go to an interview, or even attend the social functions with a beautiful smile that they carry. It really boosts their personality and, you know, self-confidence, you know. So I chose the public health simply because you have an array of patients from different backgrounds. They come in, and with very, very small procedures, you can make a big difference in their lives. And they see it. They show the appreciation. The little kids that, you know, that I have, they give me, you know, big hugs. And a lot of my older dentists or older patients, they turn around and they say, I didn't know that you could make me 20 years younger. You took away a lot of the wrinkles, you took away a lot of the sadness that I have had for the past couple of years with a simple denture that you made for me. So I find it very satisfying.
Let me ask you something. Are you married?
Yes, I am.
Well, you know what, and you have children?
I have 2 kids. Yes, I do. I have a daughter who's almost 11 years old, and I have a little boy who's going to be turning 3 this coming October.
All right, so I want you to look right in that camera because when they see it, they're going to scream. First one for your husband,
Sure.
and then one for each child.
Oh, okay. Well, this is for my husband for taking the kids out so I can be here and present this segment to you. And I give you a big hug from my daughter, Ava, and a little wave to my little boy, Cyrus.
How about you,
Sure.
Leslie?
Oh,
We can't
yes.
leave you
No,
out.
I have people that I want to say hello to too. So this is a big kiss to my husband, and this is a hug to my 16-year-old who's a junior in high school right now.
Wow.
Oh, so that's good. Well, let's get to the subject at hand because I know our viewers are saying, well, what is the health department? That seems so simplistic, but it's not.
No, it's actually a very large organization. The health department was established by referendum in 1956, and ever since then it's been growing just to because the needs of Lake County have been growing as well.
Uh-huh.
But a health department is basically there to keep the people healthy and to keep communities healthy. And we have 4 different service areas. One of them, which Dr. Rasty is a part of, is called primary care. And we have 6 community health centers. They are in Zion. There's 2 in Waukegan. There's 1 in North Chicago. There's 1 in Round Lake Beach, and there's 1 in Highland Park.
Well, I know that this show goes across the United States online, and it's seen in Evanston. So there's other health divisions of the health department across the country too, aren't there?
Well, there's public health is across the country, and
Right.
there are community health centers in cities and villages across the nation as well.
So you're just
Yeah.
speaking from the viewpoint of Lake County, Illinois.
Right, and I can talk about public health in general too, and what public health is here and how it serves people.
Maybe you could do that because I'd like to cover the
Sure.
entire area.
Sure, and I think that people don't even think about public health unless there's an emergency, but public health pretty much works behind the scenes. And so when you go to a restaurant
Uh-huh.
and you want to get a good meal at a restaurant, you're not thinking about, well, does this restaurant follow good safety measures? Well, that's the health department that's behind the scenes and working with the restaurants. So we have inspectors that come into restaurants between 1 and 3 times a year. And there's about 3,000 food establishments in Lake County. So that's one of the things that the health department does.
Uh-huh.
And then if you have a septic system or a well on your property, well, then we're sort of managing and making sure that everything's being used properly with that. We oversee sanitation, like we have a solid waste arm that is overseeing the landfill in Grays Lake. We have behavioral health services programs. So if you have an addiction problem, or if somebody has an addiction problem, you can go to the health department, and we have all kinds of different programs that address that. We have diabetes prevention programs, so that if you are diabetic, you can come into our health department and get education and tips on nutrition, exercising, all kinds of things that'll help you with your with diabetes.
Now, there was a general telephone number.
Yes,
Right.
and that's 847-377-8000, and our website is health.lakecountyil.gov or GOV.
Well, maybe you could give the website again.
Sure. Health.lakecountyil, that's all one word, no spaces, .gov.
Because I know that there could be some area that we're not talking about that people have questions.
Sure.
So I want to be clear on how they can contact, because this is basically what we are is education, and these are services that are available. Now, there's also buildings set up for different types of services, aren't there?
Yes, yes. And so, like say at this time of year, a lot of people want to get their flu shot. So the the health department has an immunization clinic where people, and it's by appointment only, so you'd have to call that number I gave to get an appointment. But so we are providing flu shots at this time of year.
And so it's flu shots, and say you have all kinds of care from, say, a woman is pregnant, or say seniors need general internal medicine care.
Yes, so we have general medical, we have prenatal, we have pediatric services, we have women's health in general.
Do you have anything on nutrition?
Yes, we have a supplemental nutrition program for women, infants, and children, so it's called WIC, and where we provide all kinds of nutrition education to families.
Do you have any kind of classes?
There are classes at our North Shore Health Center, that's in Highland Park, and you'd have to go online and check to see when the classes are, but we have like a cooking class and so that people learn how to cook using very healthy ingredients. And we also have gardens during the summer, and we help people learn how to cook using the fresh fruits and vegetables that they pick from our gardens.
And where would the gardens be?
The gardens are at our North Shore Health Center in Highland Park, and they are also at our clinic in North Chicago.
So there's 2 gardens set up in Lake County, and there's apparently the same thing is going on in Evanston, and it goes down clear to Skokie and in Vernon Hills. So these services are available all over. And if you want to get the other telephone numbers, call the telephone number that Leslie had given you. So I'm going to come back and we're going to talk with Dr. Reske, but right now what I'm going to give you is, Vita's Pearls of Wisdom. Okay, the first thing that I want to talk about is this is the fall of the year. And so, I try to keep you on track. We talk about your vitamins. When you're taking your vitamins, I tell you the same thing over and over again. But, I tell you these things because I want them to sink in here. Really take your vitamins with something to eat, or else you're not going to get the full benefit out of the vitamins that you're taking. If you just take them without any food intake, the only thing that you're really benefiting is your toilet, because it's going to go right through you. So be sure you take it with some sort of food intake. Okay, now this time of the year, it's time to change your quilt, get that down quilt, out of your storage thing. And my policy, I've told you over and over again on your clothes. If you haven't worn it in a year, dump it. And you could take it to resale shops. Now, I happen to live in a senior building. And in the senior building, we do have a community room. So in the community room is, if somebody doesn't want like some articles of clothes, we just put it on the table. You may find somebody your size and pass it on. If not, bring it to the resale shops that it can be recycled, because that we are passing on as seniors our wisdom to the next generation, and we have to tell them how to manage. We're the group that nobody is ahead of us telling us how to do it. We've lived longer than any other group, so we are the ones that have the smarts. And it doesn't take that much. It just takes being organized. Now, if you're going to give something away, don't give something away that is torn or dirty. Wash it, repair it, and give away something good. Because you don't want to give it to a person and insult them. Everybody wants to, the biggest thing is of us seniors, you know what we want to maintain? We want to maintain our dignity. I am a low-income person, and I maintain my dignity. I go to the health department. I shop at thrift stores. I'm frugal about how I don't waste any food, and I'm living the abundant life. I go to the beauty school to have my hair done because it's so cheap. I go to Tricosi, and my beauty, I went this last week, and she said, you're not a crabby old lady. I said, you know why I'm not a crabby old lady? Because I am living the life that I want to live. I'm living a life, I'm a volunteer, I'm giving out, we're advocates of volunteering. And as long as you keep that heart open and keep yourself busy, who knows, we're going to live forever. So what we have to do is practice it, and we have to be example that we're just not dried up old rocking chair prunes, okay? Now we're going to get back to the services. Now keep in mind what I tell you, because that's good for you, and I want you to practice that, because if I can do things, you could do them too. Now we're back to Dr. Mary Rathke, and I know you're going to give us a little talk on preventative dentistry, and that's what we need.
Absolutely, I agree. People take it for granted, a simple toothbrush, floss, and I'm going to tell you what needs to be done once you're done with brushing and flossing your teeth. I always tell my patients, keep your smiles healthy, make them clean, and they'll last you a lifetime. You only get one set of teeth, so take good care of it. We always talk about prevention at every single visit, whether it's exam, whether it's the prophies that we do at the office. We talk to our patients and see what their habits are now and how we can change it. Maybe get it a little bit better, you may reach the back teeth a little bit better. If flossing is difficult, we have different kinds of tools out there that we bring out. The dental assistants are really good about reaching out. If you have any kind of
Let's
arthritis.
talk a little bit about this, the
Yes.
different types of flossing, because I think that's an important part.
Absolutely, yes. Your toothbrush cannot get in between each single tooth, and that's exactly where a lot of the food gets trapped. So a simple flossing in between the teeth removes the food supplies for the cavities to take place, or periodontal disease, which is gum disease. We don't want any of those. But a simple flossing, if you're flossing once a day, maybe you need to floss twice a day, and then finish things off with brushing your teeth and brushing your tongue. That's the most important thing that people forget.
And don't you think a good diet, though,
Absolutely,
goes
absolutely.
along with it?
Yes.
And what
yes.
I always throw in, I call it the piece de la resistance, the frosting on the cake, is a good attitude.
Absolutely, yes. We always tell our patients to stay away from sweet stuff, and we remind them even a lot of the orange juice and apple juice that's convenient to eat contains a lot of sugar. And they tend to stick around, and they will cause cavities for the teeth. So we try to tell them to go with natural fruits, and natural, anything that's natural would be the best thing for the body. So in terms of absorption, in terms of keeping your teeth clean, because you keep drinking the sodas or the pop or even the juices, you keep replenishing that sugar with your teeth, and it's just not a very good combination.
Well, myself, I'm a diabetic, so I don't drink any fruit juice at all. If I want orange, I eat an orange.
Perfect.
And I eat it, as a whole orange. And if I don't drink apple juice, I eat an apple. I just
Perfect,
have
yeah.
the fruit.
Yeah.
And I think it's a better system because you're not
Absolutely.
getting that concentrated sugar.
That's
Now,
true.
I think we're going to go through more services, and you're going to give us a rundown on the services, aren't you, Leslie?
Oh, sure. We have 4 different service areas, and I've been talking about our community health centers, and I talked about behavioral health. Well, we have a service area that's called population health services, and that includes a really wide berth of all kinds of many different programs. But one of them is like lakes management, where there's like 200 lakes in Lake County, and people don't really think that much about the lakes, but they are real jewels for us all in Lake County for recreation and fishing and swimming. And so we work to restore and manage all those 200 lakes.
Well, when you're saying restore, you mean you go in and do you supply them with fish and things?
Well, we don't supply them with fish, but we're looking to what is the lake shore? What is the lake shore like? Does that need to be
Oh, the
worked
shoreline.
on to rebuild it? But it's basically very much to help the lake in terms of like the oxygen levels, because the
Oh.
oxygen level
And if
has an
there's
effect
algae
with
or
the
something
fish,
like-
with the amount of fish too.
Oh,
And so, or like you can imagine when we put all that salt, on our roads in the wintertime, that salt ends up going down into our lakes. And so trying to educate the public. Like we have phosphorus, which is something you put on your lawns, that goes into the lakes and has a really bad impact on the lakes. So a number of communities have banned phosphorus. So we're trying to educate the public about.
Well, I know I recently saw a show, and it was concerning pollution in the air that comes from different industrial plants, and that pollution goes into the water, and it forms like a poisonous substance.
Well, we are looking at, we test the water at all Lake Michigan beaches every summer, like 4 times a week. And we're testing it to see what the E. coli level is. And if the E. coli level is too high, then we ask the municipalities that are controlling those beaches to close the beaches for the day. So we have that program is in place as well.
Oh, well, that's good. Now, Dr. Rasky, maybe you could tell, like, if a person comes to the health department, is it all one price? You know, the pay scale. Somebody wants to know, well, like, how do I do this? How do I know if I'm qualified? Maybe you could talk a little bit about that.
Sure, I'll be happy to. We have a sliding scale that adjusts
And what does that mean?
That means you bring in your proof of income. If you have anything that you get from Social Security that says this is your income per month, we put that in a formula, and based on your qualification, you either qualify for anywhere from 10% to 100% discount. So it's like a scale that we use, and it depends on where you fall in the scale in terms of the payments.
Dependent on your income.
Absolutely, yes.
Does your age have anything to do with it?
No, it doesn't. No, it doesn't. We have family of 4 who come in, and let's say they're making less than $35,000, they qualify. If you're a single person or a widow, but you're on Social Security and you have, or even if you have disability that you're collecting, you qualify. So the numbers are not adjusted to age or any other specification. You just have to bring the proof of income.
Just have to bring your. Okay, so we'd like to go over some of the other services.
Sure, we
I
also.
know you go out speaking, different speaking engagements.
Yeah,
don't
so if there are groups that are interested in having a spokesperson from the health department come and give a presentation, then that we would do that. But I also wanted to mention that we have an emergency preparedness program for all of Lake County, where if there was, let's say, like something we all would dread, like a release of something like anthrax, that our health department is preparing for that kind of a situation. And if there ever were...
Maybe you should give an explanation what that is, because I don't know if our audience
anthrax.
knows.
All right, anthrax is like a poison that terrorists could potentially use to injure people.
Is that the one that goes in the mail sometimes?
Yes,
That we hear about that on
Yes,
television?
right.
See, that like there was an office, I think in Washington, that got a couple letters.
That's right.
I just wanted to connect that for
Sure.
our audience.
So if something like that, if there was a release of, if somebody purposely released anthrax, then the health department would be working to resolve that whole issue. And one of the things that we would do is have all the polling places in Lake County would turn into medication distribution sites. So there's over 100. And so it's good to know where your polling place is in case there is an emergency like this. But we would...
So that's already in preparation. See, now that I didn't know that. You know, that's really something good to learn, that in a state of emergency, that our counties and the health department is looking out for us, and they have preparation. Oh, that's a security.
And we have a medical reserve corps, which is a group of about 400 volunteers who are being trained, who are ready to help us in that kind of situation. We have a number of nurses, and we have a number of people who are already set up to man those more than 100 sites where we'd be distributing medication to people to help them if there was this kind of a release of a poison.
Well, let's say that somebody is watching this show and they say, you know what, I could do this, I'd like to volunteer? Would they just call the
Yes, they could call the general number 847-377-8000, request to be connected with our emergency preparedness program, and then they could sign up to volunteer.
But on some of these jobs you're talking about, they just can't walk into the volunteer. It takes a certain amount of training.
Yes, and we have all kinds of people at all different levels. They're doctors, they're nurses, or they could be administrative assistants. So we're looking for all kinds of people to help us.
And it's probably flexible depending on what they are and what they want to volunteer for, for the amount of hours. So that's a good place to volunteer, because that is giving back to the community. And each one of us, should do that, because that's how we establish a stable society, not a society of self-entitled people, and as seniors, we want to establish that. I know that you're open to more than the senior population on the volunteers. Now, a volunteer probably has to be at least 18 years old, though.
Yes, we're looking for adults, yes.
So 18 to 99?
Yes, 18
is that
to
a good
100.
range? One of the things that I'd like to talk to the two of you lovely ladies about is that I get a satisfaction out of my job that I'm reaching people and educating them in how to live longer as a senior, because we're living longer than any other generation. But I know the two of you came in beaming today, so that you're getting satisfaction, that you're putting passion. You're both passionate women. And so I'm going to start with you, Leslie, and if you could just look into that camera, because we want to inspire somebody out there saying, that I think I could do something.
Mm-hmm. Well, I think going back to my years of serving with the Peace Corps, that I always wanted to help people and do something where I knew that the work that I'm doing 40 hours every week was contributing to help the community. So I really love my job working in public health, because I know that I'm having an impact on Lake County residents and the health of the community as a whole.
And Dr. Rasky, can you just look in that camera?
Sure. With my years of public health service and seeing a lot of our patients at Lake County, I would advise everyone to keep a healthy mind, healthy body, and don't forget to keep a healthy smile, because we love to see our citizens and residents of Lake County to be able to smile and keep up the good spirit. That's for sure.
You know what time it is now, you out there who's watching me right here. When you come to the end of your rope, you tie a knot and hang on. You know why? Because the best is yet to come. What we want you to do this week is catch the spirit. And we're up.
Oh, that was
Hi, thank you for having